any form of pain relief, whether that's pain medication or an ultrasound guided injection, doesn't solve the problem. It only stops you from feeling the pain, that's it. If, like a lot of patients, you're really confused about the best type of medicine to take for lower back pain relief, then this video is definitely for you. I'm going to be breaking down the different types of pain relief, 5 different classes of medication. And right at the end, I'll talk about steroid injections, and I have one pro tip for you. This one pro tip is such a game changer. If you're thinking of taking any medication, it's something you have to know. So make sure you watch until the very end. Hello everyone, my name is Joy Agude. I'm a chartered physiotherapist and the proud founder of the London Physio. We are a virtual physiotherapy service that you can tap into from anywhere in the country. We can also, by the way, bring physiotherapy to you. If you're in London or the Midlands, we can literally come see you at home, at work, at a residential home for the elderly patients. Wherever you are, we can bring physiotherapy to the comfort of your own home. And we're open 7 days a week. Disclaimer, I'm a physiotherapist. I do not prescribe. There are some physios that prescribe. I'm not one of them. And even they can prescribe medication to you online. So remember, you're watching a video on the internet. Do not take this as medical advice. You need to see somebody one-on-one to help you with that. That being said, I am a physio that's been around for 15 years and I see a lot of patients with lower back pain and all sorts of pain. 95% of my patients are on medication. We talk about medication all the time, and I've seen them make a lot of mistakes over the years. So here are some things that I've learned from my practice as a physio and from my patients that I treat. Without further ado, let's get into it. The easiest one to talk about is analgesia. You've heard of paracetamol, right? It's one that you can get over the counter. If you're watching from a different part of the world, then, there's so many different names for paracetamol. But in the UK, that is what we call it. It's one that you can literally get from Boots, even at a petrol station nowadays, paracetamol. It's easy and it works. Personally, paracetamol is usually my maximum because I don't take meds. I don't know if it's because I'm a physio, but I'm just so obsessed with what is the reason I'm taking the medication for? Like, what is the root cause of the problem? Let's start there. I'm also somebody who doesn't wait for pain to get worse, but it took me a while to get there myself. So I used to say that to my patients all the time. Don't wait until the pain is bad. Go and see somebody. But it took me as a human being a while to get there myself. Especially as we get older, you can't afford to mess with your health. Your body is all you've got. Your health is all you've got. Your physical health is linked to your mental health, your emotional health, your psychological health, your spiritual health. Your body is that vehicle. I do not mess with it at all. So for me, paracetamol is actually like, if I'm taking it, something is really bad. And because I never really take tablets that much, it really works for me. So paracetamol or analgesia generally is just for pain, musculoskeletal pain, if you like, just aches and pains. The very low level, it's just there all the time, That's kind of what you take paracetamol for. Some people also take paracetamol as a sort of like midpoint, like maybe they're taking other things that are stronger, and then they take paracetamol in between just to kind of keep themselves going, but because it doesn't have as many side effects. The second class that we're going to talk about is NSAIDs, non-steroidal anti-inflammatory. So you take them to combat inflammation. Pain, by the way, is also a sign of inflammation, of course, but things like the swelling, the heat, the redness, those are signs of inflammation. And sometimes you can't quite see inflammation, but you might have certain things that we know are inflammatory in nature. Non-steroidal anti-inflammatory tablets, you can take them as oral, like put it in your mouth, or you can have gels. So you can have anti-inflammatory gels that you could put on certain parts of your body. The main difference is that the gels only work locally. So if I put the gel on my back, for example, my lower back, it would only work on my lower back. Whereas if I take an anti-inflammatory tablet like ibuprofen, then if I have a headache, that will solve it. If I have shoulder problems, that will solve it, So it goes through your entire body, and that's the main difference. One is more local and then the other one's more general. But then anti-inflammatories that you take orally can also cause you some irritation to your tummy, and not everyone can take anti-inflammatories. So make sure you check with your doctor or your prescriber if you're actually allowed to take anti-inflammatories. A lot of the patients who take anti-inflammatories that are stronger tend to also have something else to help with the lining of their stomach. So they take another drug to help reduce the irritation in the tummy. So just bear in mind that anti-inflammatories can be oral and they can also be gels. But as far as I know, you should not be using the gels and taking the oral tablets. You should always use one or the other, but that will be discussed with you by the person prescribing. If you're getting an OTC tablet, so for example in Boots, go to the counter and ask them. There are always pharmacists there. Just ask, how should I take this? When should I take this? They have so much knowledge to share. The last thing you want is to go and buy an OTC tablet and just assume that everything's fine. Speak to a professional that can literally give you free advice. You don't even have to pay for the advice. Just ask them about the drug and maybe tell them some of the other drugs that you're taking so they can give you some level of advice on whether or not, those drugs might interact with each other. So the next class of drugs we're going to talk about is opioids. If you notice, I started low and now we're talking the big boys. We're talking opioids. Some examples of opioids would be morphine, codeine, tramadol. These are the ones that you can definitely not get over the counter. It doesn't matter how much pain you say you are when you go to Boots, you're absolutely not getting it. You need to get a medical professional to prescribe this for you. Now, they're very, very careful who they prescribe. Can you imagine morphine? When you're in a lot of pain, the reality is you are desperate. Like, I've been a patient. Let me tell you, you are absolutely desperate for anything to get rid of your pain. The thing is, these meds work really well. So for example, if you take something like morphine when you're in a lot of pain and your pain disappears, can you imagine what that does to your brain? The next time the pain comes back, because it will. Remember, we're talking about meds not actually fixing the root cause. They only take the edge off or take your pain away completely. They stop you from feeling the pain, but the real problem is still there. So the next time the pain comes back, all your brain wants is that thing that takes it away. The doctors are always very careful. On this level, it's all like extra care. They have to look at your past medical history. They have to look at the other drugs you're taking. They have to look at even your behavior, your personality. Are you somebody who will get addicted very quickly? Or they look at all sorts of things. They're like biopsychosocial analyses that happen with things like opioids. So they're very, 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 very careful because people genuinely can get addicted to these meds. And at this point, we're talking about severe, debilitating pain. Meaning, if you went to your doctor and you complained of pain and the first thing they gave you is morphine, that is a red flag. That is an absolute red flag. There's so many levels before you even get there. Like, no doctor I know has ever done that. The other thing I will be asking myself at this point, if I was a patient that was getting to the point where ibuprofen's not working, paracetamol's not working, diclofenac, naproxen's not working, and now I'm getting to morphine, what I would be asking myself is, at this point, do I know the actual diagnosis of my condition? Because if I don't know the diagnosis of my condition and I'm now starting to take morphine, then if you think about it, there is no plan to get off the tablets. Anytime you start taking something serious, for me, that's paracetamol, remember? But anytime you start taking something serious, especially at the opioid level, you need to, number one, understand the diagnosis. So if your doctor is not telling you that this is exactly what you have, and they're not referring you to someone that can tell you, like a chartered physiotherapist, I can't tell you not to take the tablets, but all I'm telling you is that's a slippery slope. You need to understand what it is that you're dealing with, why you're taking the tablets, how long you're going to be taking the tablets for, all of that stuff. Let's move on to the next class. Class number 4 is muscle relaxants. Now, I may not be giving you the exact names of the classes here, but I'm kind of telling you them in a way that you understand how your symptoms might also mean that this is what you take. So the reason why I've called them muscle relaxants, it's because if you have things like muscle spasm, these are the kinds of tablets that they might give you. So one really popular one is diazepam. A lot of people who have muscle spasm tend to be given diazepam, but again, similar to the last class that we talked about, similar to opioids, the doctors have to be really careful who they give diazepam to. Diazepam has strong side effects and even withdrawal symptoms as well. Some side effects might be things like headaches, nausea, vomiting, and even constipation, and a few other things. I don't know if you guys know this, but with every video that I release, I actually write a blog. So I'm gonna put some links in the written blog. I'll put some references in there, trusted references, just in case you want to learn more about things like the side effects of different drugs and stuff like that. It's in your best interest that if you're being prescribed medication, that you know what the different side effects might be before you take them, as opposed to just taking them, feeling better, and not knowing that you might have problems with fatigue or constipation, because even those things could be a shock and they could really add to your suffering and just make the whole situation worse. So be sure to check out the link in the description for the blog, which will have all the links that I've talked about. The last class of pain medication that I want to talk about is I've classed them as other. The reason why I've classed them as other is because they prescribe them for different things, but the tablets themselves, depending on the dosage, can treat different things. So let's start with the name. So gabapentin, pregabalin. Again, at this stage, these are not over-the-counter tablets. These are all prescription, full stop. So gabapentin, pregabalin, we'll just stick with these two for now. For the most part, they're given when you have nerve problems, okay? So if you have nerve pain, things like sciatica, I've made a video on have I made a video on sciatica? Yes, I have made a video on sciatica. I will link the video in somewhere on the screen. I've also made a video on non-specific lower back pain, and I've made a video on some other type of back pain. I will link them all here, okay? If you have sciatica or you have nerve pain, some sort of pins and needles, numbness, shooting pain, burning sensation, those kinds of symptoms, gabapentin, pregabalin, these are the tablets that target that. And this is why it's so important to get the diagnosis right. Because if your doctor gave you anti-inflammatories, for example, and your diagnosis was sciatica, it's not that it wouldn't help. It would help with the other things that are happening. So it might help with reducing the inflammation. If, say, for example, the sciatica is being caused by something like facet joint irritation, which can cause inflammation in the area, it would help with that. But it's not going to help with the actual pins and needles, the numbness. But what will help with that are the medications like gabapentin and pregabalin. But again, they're so careful. Why? Because these tablets also treat other things like epilepsy, anxiety. Yes. These tablets are also used to target your mental health. So just be careful that, number one, your doctor is explaining to you what dosage you're on, what he's giving you the tablet for, when he thinks you're going to come off of it. There needs to be a plan. And if your doctor, because GPs are not there to diagnose, really, they are general practitioners. So if your doctor's not sure, ask for a physiotherapy referral. Ask your doctor to send you to a physiotherapist, get a diagnosis. If needed, your physiotherapist might refer you for an MRI scan. We definitely do that if we're not sure or we need a confirmation, or even just out of preference, because maybe you come to us at a point where you've had the pain for so long and right now you're I really just want to know because the pain is not going away. As long as it's clinically indicated, we will refer you for an MRI scan. It's so easy nowadays to get a diagnosis, even when we see you virtually. There is no reason for you to be on a medication and not know your diagnosis. That is such a slippery slope. It's like just hoping that everything will be fine and everything will go away. Hope is never a strategy, right? So especially when it comes to your health. So we're not doing that, not in 2025. Nowadays, you can easily book an appointment, literally with us, 2 minutes, book an appointment, same day sometimes or the next day, you have a virtual consultation or we come and see you. We can diagnose you, give you a treatment plan, and at least if you're on medication, it would be very clear when you're coming off the medication or how long we think you may be on the medication for. And this is synergy between us and your doctor, okay? That's it for the meds. Now, I want to talk about something else that a lot of my patients get, steroid injections. Now, notice how we've gone from like level 0 to level 1 to level 2 to level 3, Some of these stages also overlap. Some people could be on gabapentin and still be on paracetamol, or gabapentin and ibuprofen. You know, of course, you can take multiple meds for different things if your doctor feels that it is right. The difference between medication orally and steroid injections, or an injection in general, is that the injection goes to the exact site. Nowadays, they give you an injection under ultrasound. So it's called an ultrasound guided injection. So they can see exactly where they're injecting, the site of the inflammation exactly. They go there and they push the injection in. And for most people, the pain goes away eventually. For some people, that could work for 2 weeks. For some people, it could be 2 months. For some people, it doesn't even touch the pain at all. But the thing is, for the people that it works for, they get so excited. They're like, oh my gosh, my pain is gone. I'm going to stop physio now, or I'm just going to stop whatever. They just carry on with life. Remember, I just want to keep bringing you back down to earth and to reality. Any form of pain relief, whether that's pain medication or an ultrasound guided injection, it doesn't solve the problem. It only stops you from feeling the pain, that's it. And even if that window is like 2 months, it doesn't mean the issue has gone away. It really hasn't, okay? But what can sometimes happen is that some doctors will refer, especially in private practice, some doctors will pretty much just inject patients without going through any of the other steps and without referring them for physio. And it's a really sad practice, because we all know, the doctors included, that your pain will only be covered up. It's like putting a plaster over something, you know, the wound is still there, but yeah, the plaster is helping, but the wound is still there. When you opt in for an ultrasound guided injection, some of the questions I would like to be asking would be things like, have you seen a physio? Do you know the diagnosis? Have you had conservative treatment? Have you gone through all the different steps of medication before you even get there? You know, because that is sort of the step before surgery in a way. Like, you've tried everything else. You've tried physio, you've tried all the meds, you've tried all the different combinations, tried an injection, then surgery. But nobody goes from like 0 to injection. So it's a really sad practice that happens, but I'm not a doctor. I'm sure they're doing the best they can. But as a patient, just remember that you have the right to ask these questions, okay? We have talked a lot. Now let's talk about the one tip that I promised you. Now remember, we're talking about pain relief, especially for the lower back, but this could really apply to any part of the body. The one tip that I want to remind you of is that your body has its own capability of helping with pain. Now, I usually say to my patients that by the time you start to feel pain, your body has done its best. Its absolute best to try and combat it. But people forget that one of the ways that your body actually helps heal itself is exercise, like actual movement, and specifically the lower back. Your lower back enjoys movement, your spine in general. I've said this in other videos. Go and watch the non-specific lower back pain video. Go and watch the sciatica video. Go and watch the other video that I made. Your spine loves movement. Movement, movement, movement. And I know this. I know that some people say, but every time I move, it hurts. It's because you're doing the wrong movements, okay? That's why it hurts. Your body likes movement. The stiffness makes it harder. The more you live a sedentary lifestyle, the more you are still and you don't move as much, then everything gets stiff. Your joints get stiff, the muscle gets weak, less support around the lower back, and therefore you get pain. But exercise, the right movement, is so good. It's like almost like the best natural pain relief. And if you're struggling to figure out what the best movement is for you, or the best form of exercise, for some people, by the way, that could be swimming, it could be walking. For some people, it could be the physio exercises. If you're struggling to understand the best form of exercise for you, then you absolutely need to see a physiotherapist, a chartered physiotherapist, or even speak to your doctor. It all boils down to knowing what the diagnosis is. If you know what the diagnosis is, you'll be able to know the best kinds of exercises for you, and then you'll be able to kind of stick with them so that you can get the best results. That's how it goes. So if you had sciatica and the sciatica was as a result of spinal stenosis, I've made a video on spinal stenosis, go watch it. If you had sciatica, but you didn't know that the reason for the sciatica was spinal stenosis, you might be doing exercises that would help sciatica, but as a result of a disc bulge. Now, these are the opposite movements. And if you were doing that, you will just be in more pain, okay? Likewise, if you didn't know that, walking could be good for you, or swimming could be good for you, or certain aerobic exercises could be good for you, or core stability exercises could be good for you. If you don't know which exercises are great for you, you're just going to be doing a mixture of everything, and that might actually end up making your pain worse. So initially, you need to figure out what is the root cause of the problem, what exercises can I do, because remember, that means less side effects, less risk of addiction, all of that stuff. What exercises can I do to actually help the situation so that long term I can fix the actual problem, or I can manage the actual problem? And if there's one thing that I want you to take from this, it's only use your medication as something that gives you a window of opportunity to deal with the root cause of the problem head on. Don't use your medication as the cure. It doesn't work that way. That's as much as I have for us today. I don't want to overwhelm you. It's been a bit of a long video. If you've struggled with medication issues or anything like that, then please leave comments. Let's hear your story. If you have any success stories as well, share it with other people in the comments. And if there are any specific videos that you want me to make, then please, please, please leave them in the comments and let me know. And if you've enjoyed watching this video, then more than likely you're going to enjoy the videos on the screen right now. So make sure you click on them to get some more information. Thanks for watching, and until next time, look after yourselves and each other.